So welcome, we're so glad that we have a chance to share with you some of ExpandNet's learning and experience with scaling up, with supporting different kinds of initiatives to work systematically on scale up. My name is Laura Ghiron, and I'm a member of the ExpandNet Secretariat since its founding in 2003. And I am joined by my very dear and longtime colleague, Alexis Ntabona, who is also an ExpandNet member since the very beginning in 2003. And Alexis and I are both going to talk to you about some of our experience with the theory of scaling up, as well as applying it in practice. And so we're really excited to share some of that learning with you. Of course, we don't have very much time, but we are giving a masterclass on Wednesday if anyone is interested in digging in more deeply to some of the issues that we raise in a cursory way today. We want to encourage all of you to use the chat box as we're talking so that you can pose questions to Alexis or me. You can ask for clarifications, you can share some of your experience. We also have a couple of questions for you, and we'll pop them up there after we're done doing some speaking. So we thought that I would get started by talking a little bit about where ExpandNet comes from on these issues, how we came to learn all of this, and what we want to convey in this short amount of time that we have with you. So ExpandNet, as I said, was founded in 2003 because in this work that we were doing with the World Health Organization, many of us were working on scaling up, but there wasn't a lot of guidance on scaling up back at that time. And so there were several of us who were coming together in a series of meetings focused on scaling. And this was one of our big realizations, is that scaling up is not just a narrow technical task. Like if you're an expert in reproductive health, it doesn't automatically make you an expert in scaling up, because in fact, scaling up is an organizational, managerial, political, and policy task, not just a technical one. And the other thing that we learned as we were doing this work early on is that one can't leave scaling up to chance. It has to be done systematically. And there has to be planning and strategic management that are very intentional. One of the other things that we recognized very early when we were coming together and learning more about this issue in the early 2000s was that there wasn't a consensus around a definition for scaling up. I'm sorry to say that almost 20 years later, there isn't a really broad consensus, and that's not surprising. But ExpandNet's definition that we hammered out back in 2003 around the table from many different projects who've been working on scaling up, this definition has really stood the test of time, and lots of different organizations have embraced it and have been using it to help guide their scaling up work. And so here is the ExpandNet definition. It says, deliberate efforts to increase the impact of health service innovations successfully tested in pilot or experimental projects so as to benefit more people and to foster policy and program development on a lasting basis. And the interesting thing is, if you went ahead and took apart each of these pieces that I've highlighted in the definition, you really can have a broad understanding of what ExpandNet means when we talk about scaling up. First of all, deliberate. As I said, you can't leave scaling up to chance, ad hoc approaches, or just saying, at the end of a research project, this should be scaled up and hope that it will be. That's not going to work. So it has to be deliberate. This term, use of the term innovations is something that we borrow from the diffusion of innovations literature. And it just means that this is something new in the setting where it's being implemented. It's not necessarily new everywhere. It doesn't have to be innovative. It's just new there. Successfully tested is where we talk about the need for local evidence. For example, we may have an evidence-based intervention that's been proven again and again in different countries, but we need to understand how to implement it locally. And so that's the successful testing that we're really talking about. Of course, we want an evidence-based intervention because we don't want to implement something that we don't have evidence is working. And then the issue of benefiting more people. This is most commonly where people think about scaling up. This is really rolling out. We call it expansion or horizontal scaling up. That's extending it to this intervention package to more areas. But we also want to balance working on that with anchoring the intervention package in policies and programs. And that's where fostering policy and program development is really important. And we often call this kind of work institutionalization or vertical scaling up. And then finally, in the definition, on a lasting basis, of course, points to the need for sustainability, because if we're not sustaining everything that we are putting in place, then the scaling up work becomes less meaningful. And we really want to be sure that that's a priority focus. So ExpandNet, as I said, we began, really in the late 90s working on these issues, and we found that there was not very much guidance, as I said earlier. And so we began our journey in this guidance provision effort by writing a book that lays out our scaling up framework, and then is followed by 7 country case studies of actual scale up experience, really reflecting on what was learned about scaling up from those cases. And then people were saying to us, well, yeah, this book is great, really interesting, kind of academic. So we decided to develop a guide called Practical Guidance for Scaling Up Health Service Innovations. And this was, I just want to make sure that everybody's getting admitted. This was an exciting effort because we started to really share some of the case experience, but also start applying it to actual projects, really trying to help people with the scaling up task. And that's where the guide 9 steps for developing a scaling up strategy came into play, where people were saying, really interesting that you're doing this work, thank you. How can we actually scale up? And that's where the 9-step approach came into play. And now a lot of people have been using this 9-step approach to really help plan, strategically manage, and guide their scaling up work. Of course, all of these guides are available on the expandnet.net website, and we hope that you will make use of that and that you'll sign up for our newsletter, which is a very infrequently shared document. Good. So the next slide talks about the most recent guide. So as we were helping different projects with the scaling up task, giving technical support to these analyses and the 9-step approach, we found that a lot of projects were saying to us, well, if only we had thought about this when we designed our implementation research, our action research project, then they would have designed it differently. They might have implemented it differently. And so that's where we more recently developed this guide called Beginning with the End in Mind, Planning Pilot Projects and Other Programmatic Research for Successful Scaling Up. And even though it's our most recent guide, it's really become quite critical, especially in the implementation science realm, where people are designing projects, because while there's lots of good guidance on good methodological programmatic design guidance, there isn't a lot of guidance on linking that to scalability. And that's exactly where this guide comes into play. So ExpandNet, whoops, there we go. As I said, ExpandNet has developed this framework for thinking about a scaling up system. It's a systems framework. And I'm not going to go into it much now, even though I would love to, because sometimes when people see this, they're like, don't show me that. But I want you to not be intimidated by this framework, which is sometimes the case, because it can be really useful in making sense of what I call the buzzing, blooming confusion that scaling up often is. Sometimes it's 2 steps forward, 1 step back, but really, if you have a roadmap like the ExpandNet WHO framework for scale up, it helps you make sense of the different actors, the different modalities, the different needs, different resource constraints, and tasks that are involved in scale up. It's really helpful. So the guides, of course, go into this framework in detail, so we're not going to do that here. I will highlight a couple of things though. There are 4 main types of scaling up. 3 of them are guided. I already talked about in the definition the horizontal kind and the vertical kind. And then the third kind of guided one is diversification, where you add different components to an initially tested intervention package. And this is part of adaptation. It's an issue for fidelity. There's a lot of issues. So thinking that all through and using the framework to analyze these strategic choice areas that are all along the bottom through the lens of whichever type of scaling up you're working on. And that's how the 9-step guide is laid out, and really people have found quite helpful in making sense of the confusion. And the last lesson that I want to point out is that, and I think I mentioned this already, is that both expansion and institutionalization are critical to work together. We can't just be working on expanding and expanding and expanding and not necessarily anchoring our intervention package. For example, we may figure out how to train service providers in a specific intervention package for implementation, but we haven't figured out how to institutionalize that, for example, in pre-service training, so that we don't always have to continue moving around to all the different service points. Instead, we can get people where they're being trained. So these are some institutional and expansion not tensions, but complementarities that we might think about when we're working on scale up. So that's just a quick example. I don't want to talk too long. I'm going to give the floor over to my colleague, Alexis Ntabona, who I also want to introduce right now, because Alexis is an incredibly experienced ExpandNet member. He has been working in the field of global public health, particularly. I think Alexis has been in 95% of the countries across the African continent, and knows people all over the world, and has been working on scaling up and supporting different scaling up initiatives for many, many years now. So I want him to have an opportunity to share some of that experience with you, and to just in a cursory way, because this is technically an Ask the Expert session, so we really want to give the floor over to you all. So as you're listening to Alexis, from whatever you heard from me, if you'll pop some questions into the chat, that would be great, because we're going to talk about those as soon as Alexis is done with his remarks. Because we also have some questions for you, because that would be really helpful for us to understand where some of you all coming from. And so we will also do that in the chat with the short amount of time we have. Okay, so just a quick introductory bio for Dr. Ntabona. He is an OBGYN trained at the University of Kinshasa in the Democratic Republic of Congo, where he currently lives. He has moved home after being at WHO in Geneva for many years. And he has his master's in public health from San Diego State, and has been working in was a faculty member at the School of Medicine and Public Health at the University of Kinshasa for many years before joining WHO. He was also at the Regional Office for Africa of WHO as a regional advisor for safe motherhood and reproductive health later. And after several years at WHO Geneva, he retired and moved home to Kinshasa, and since then has been working with ExpandNet to give technical support to a wide variety of scaling up interventions and scaling up projects in many countries: Madagascar, Mali, Sierra Leone, Senegal, etc. So I think the experiences Alexis is likely to mention today stem from Senegal and DRC, maybe just one. So I'm going to yield the floor over to you, Alexis. Please proceed.
Thank you, Laura. Actually, this introduction makes me younger than what I look. Anyway, yes, from the past 10 years or so, since we started providing support to the implementation or the application of this guidance, which we have just described in the countries in the various programs, but more frequently it was about family planning. I came to realize that in most cases, it seems that in the question about scaling up in terms of horizontal scaling up has been out there in a variety of understanding, but something which has been received as new has been the component on a vertical scaling up, because it has helped the countries to understand that this is a process which, once it is started, can go fast in terms of institutionalization. Some of the experience we have in here in DRC has shown that, because it may be easier, for example, the example which Laura gave about the pre-service training, especially in a context where the competency-based approaches have been introduced. It seems that the understanding about the institutionalization makes it very difficult for them to realize that if they only do the expansion, which is the horizontal scaling up, probably that may not be sufficient, especially to reach what the last slide was showing, a durable and sustainable scale-up phase. That has been one of the lessons we got with the application. The other lesson we have received from the application in countries brought us back to when we started in 2003. It was very clear that we were facing a situation where the project-based approach to innovations, without taking into consideration that all these, any successful outcome of this approach will need to be translated into programs, which is the other part of the scaling up definition. It became very clear that that gap needed to be bridged, so that from this, in the later application, we need to understand that it's important to bridge that gap and make sure that whatever we start, with the beginning, with the end in mind, let's make sure that sooner or later, and possibly as soon as possible, it should be done as a program, part of the program development. And that is something which is well understood now, but we are still grappling with the idea of knowing, is it actually being implemented as such? So we have captured that in some of the publications which you will find on our site. For example, it's very clear that most of the work we do during the testing phase is to get the proof of concept that it works. But getting to the level of making sure that it works within the system, that's the element which we need to continue strengthening. And already in 2000, early 2000, was felt that that was a big gap. We need to start reflecting on this as soon as possible to make sure that it is done. So I can also stop there by maybe apologizing for not welcoming you all to our session, which is asking the expert. But I think most of the questions which we want to deal with should come from you. So I'll take that to Laura to see how we can do that. Thank you, Laura. Thank you, everybody, for listening.
Great, thank you, Alexis. So yes, this is a time when we can really open up the discussion, because as this is billed, this is an Ask the Expert session, but like Alexis is saying, you too are experts in implementation, and you all are learning about how to do implementation well. We do have a couple of questions in the chat already to address. I also would love to open the microphones for anyone who would like to pose their question. Vidya has posed a challenging question for us about the relationship between the public health system policymakers and engaging the private sector implementation researchers. So these are really exciting kinds of questions, and we do have some experience under our belt in that, although not a ton. So we'd love to talk about that, and we'd love to hear your questions. Vidya, do you want to just talk for a moment about your question? Where does it come from, and what what are your biggest concerns? I know you've tried to articulate it here, but we'd love to hear from you if you're up for that. Otherwise, we can just go with what we have. Go ahead.
Yeah. Hi, Laura, and hello, Alexis. This is Vidya, and I work as an audiologist, speech-language pathologist in the south of India. And I'm currently trying to work with the public sector system to integrate an intervention which is primarily using ICT for enhancing the consistency of rehabilitation for children with disabilities. And so I do have the public sector system supporting, but it comes with a lot of resistance. It comes with a certain sense of suspicion as to, you're a researcher, what is in it for you and what is in it for me. And, there are layers of doubts, and I can see that it's not very easy. Like, just in the implementation space, engaging with stakeholders is one of the key factors. And when we try to do that in the community, there's a constant element of doubt of you being an outsider, you're not, whether you're going to publish information about the government, are you going to say something that's not good? So, I feel very limited, and I feel very stifled at times to be able to go the full mile, to be able to do exactly what is required. So how is it, what does it take? I know one for sure, that it takes credibility, because I know I tried this 10 years ago and nobody wanted to work with me, plain because I didn't have the experience. And with time and with other work that I was able to do, I was able to build that credibility. But even then, is it easy for others? Is there a certain way that people are able to engage with governments? What does it really take to get this collaboration to a point where they see us as people who are just there to understand the system more, not to criticize or to say you're not doing it well, but I want to do this with you because I have certain skill sets, and and I want to be of help, really.
Yes, that is a really, Vidya, wonderful question, and a really interesting experience that you're having. It sounds challenging. And sometimes, even though Alexis and I work in more of the family planning reproductive health field, there is also some suspicion that we face in this work. And one of the things that we have found in scaling up is that the messenger is really a very important component of generating friendliness towards the innovation and or political will to implement it, etc. And so my thinking as you were talking was that, you know, maybe part of the challenge for you would be to figure out how to get some champions who can be your message carrier, who are from within that system. And how does that happen? Well, it happens by actually implementing the intervention within the system where scale up is supposed to take place. And in so doing, cultivating those champions who can be advocates for the approach so that members of the institution that's intended for implementing at scale, that there is internal advocacy coming from that system and not necessarily from the outside researcher, even though the outside researcher is a critical engine in the entire process. So that's kind of a short answer. It's hard to get a full one. Alexis, do you want to weigh in, or do you want to maybe look at, have you been spying one of the other questions in the chat that is emerging? And don't forget to unmute.
Yeah, thank you, Laura, and thank you, Vidya, for the question. The private sector in the context of India probably is more of those who are for profit, or they are really separate from the public sector, which in most of our countries seem to be kind of working directly under or with the public health sector. For example, when I look in the context in the country I am from, that where I live now in Congo, when we talk about private sector, we have those who are for profit, like mining companies and so on. And from the legislation, there is already something showing that any company which is private and has some social services within it has to make sure that they can also work on those services. And in the case of mining companies here, they have been spearheading that element, and they've started providing family planning services in support of what the public health sector is doing, but in collaboration with the Ministry of Health. We have also the other example where we don't know whether we should classify it as a private sector. That's the faith-based organizations. They have the biggest chunk of the health sector provision of services, especially at the community level. And it seems that having to work on some innovation, we have learned that we need to constantly involve them from the beginning, as we do recommend in our guidance, most recent one, which we described earlier, which showed that once you have brought them into the picture from the beginning, they become at the end, they become the implementers actually of the scaling up phase. So private sector, it varies from place to place, and it has to be adapted. And that's part of the work which need to be discussed during the strategy development, especially when we are discussing the context. Thank you.
Great.
Thank you, Laura, and thank you,
Thank
Alexis.
you, Lydia, for the question. So Rebecca has a question where she says, in an example of where you might be trying to select a project to work on that is most feasible for scale and spread success, when looking at different projects, how would you compare or determine the scalability or feasibility of different projects? So this is a really good question. And amazingly, I've been getting this question a lot in the last 2 weeks because, and people come at it from a different angle. Like they may be asking, if I'm say in government and I'm faced with, 10 different models to implement kind of the same thing. How would I choose, or how would I help government choose between them? Or other people are coming at it from the question of this issue of scalability. How do we know that this is a scalable model or not? And, you know, these are really tough things to face in scaling up, right? If there have been many people implementing the same, to address the same issue, but slightly different, their sources of evidence are different. These are really difficult things to face when trying, if you're, let's say you're the Federal Ministry of Health and you're trying to make a decision about which one to go with, and everyone is saying, here, adopt my baby, well, you have to adopt my baby. It's really hard. And so this is where analysis of scalability is really helpful. And it's also really helpful when a project has tried to begin with the end in mind. And as Vidya is sort of hinting at, and we're answering, is to the extent that you have the support of stakeholders from the beginning. That's really step one, or recommendation one in our beginning with the end in mind guide, is to have members of the eventual adopting organization as part of your planning team, as part of your implementation team. Not only does it build political will from the outset, but it also helps shape the intervention package in ways that will make it more scalable, because it will be designed for the system in which scaling up is to take place. Alexis, we have a lot of experience with this in Hope LVB. Do you feel comfortable talking about that for a minute or two with everyone? Remember the scoping work that we did? I could talk about it if you want, but up to you. You could talk about a different example. Feel free. Oops, you muted. Yeah.
Yeah, this is a very interesting question, because it refers to the scalability potential. Because at this point, the feasibility aspect need to be already tested during the beginning or the testing phase. Let me take back to the early 2003 when we started with the work on scaling up. You may recall, for those who have reviewed our guidance on 9-step guide, that we refer to the diffusion of innovations, which was discussed long time ago. And some of the elements which are proposed in that science showed clearly that when we have reached the stage where we need to start asking ourselves, is this a model which is potentially scalable or not? The first element will be to really review the innovation itself, and that's what we have recommended, because already long time ago they had suggested what they call correct attributes. For example, when we start with an innovation which has been tested and we can make sure that it is credible, that's the first C, or the outcome is really observable, that's the O. That's an acronym actually, correct. We need to see whether the innovation is really perceived as very relevant. That's the first R, and really has advantages compared to other approaches. That's the second R, and easy to install and compatible with the system. And you can give those who want to work with you the possibility of testing it. In the few years we have been trying to promote the analysis of the scalability potential, when we go through those attributes, most of the time people are able to say, well, I think we are credible, we can observe everything we are receiving, but most of the time they come to realize that either it was relevant for the researcher, but not necessarily for the program, or it doesn't have so much relative advantage for those who going to adopt it and implement it to make sure that they really see it as very advantageous. And also easy to install. The easy to install element requires that you are able to share with them what you actually did. So I think that's why we were saying in the beginning that the biggest gap we got in 2000 when we started promoting the scaling up systematic approach, it became very clear that most of the time these questions start being raised when you are already anticipating that you would like to start the scaling up phase, and it's a bit late. So in a nutshell, make sure that the feasibility aspect has been tested. And second, once you have tested and you have a successfully tested innovation, make sure that it will be easy to install because you know how it is done, and you give the adopters the possibility of testing it, which is the testability aspect. I think I can stop there to see whether we can have responded to the question. Thank you.
Yeah, thank you, Alexis. Let me just elaborate a little bit on one thing that Alexis was talking about, which is the correct acronym. And he's laid out for us the different, what each of those letters in the acronym correspond to. Correct, credibility, observability, relevant, relative advantage, ease of transfer, compatible with the adopters, and testable. So that acronym comes from decades of research on knowledge utilization, diffusion of innovation, as Alexis was saying. So what ExpandNet did was try to use that learning to both shape our framework and try to give guidance to people. So Alexis is very fluent in those, but maybe some of you've never heard of that and maybe you want to learn more. So that's where our guidance documents are super helpful because they'll give you some background learning about that elaborates. And in particular, in addressing this question, our beginning with the end in mind guide has a scalability checklist in it. And so it can be helpful to use that checklist to analyze how a given pilot intervention or implementation research initiative is being undertaken. You can analyze it along all of these different variables, some of which reflect the correct attributes, others that reflect other areas that we know ensure future success with scale up. So I'm pointing you to, I think, page 17 of the beginning of with the end in mind guide so that you'll find it helpful, in case you find it helpful. And then an example from our experience where Alexis and I were working with a project in East Africa called the Health of People and Environment in the Lake Victoria Basin. Our colleague from HOPE LVB is the acronym, will be joining us on Wednesday. The three of us are going to be giving a master class on scaling up, and Charles Kabiswa can talk very beautifully about some of this experience applying ExpandNet guidance to an actual project from the very beginning. We had a chance to apply the beginning with the end in mind guidance, and then when we had some assurance that what was being implemented was appropriate and successful, then we moved on to developing a scaling up strategy. And I think I did not share the slide. I'm going to just show you guys one more slide, and that's this one, because somehow I skipped over it, because our guidance, it really lends itself to this systematic approach to scale up, where if you begin with planning your project with scaling up in mind, then you move on to logically developing a scaling up strategy. Then you really need to move on to strategically managing the scaling up process. And this is where most projects really drop off. Like, they're lucky if they develop a scaling up strategy, but by this point, a lot of the resources for monitoring and evaluation are gone. People have this unrealistic expectation that the system or the implementing organization will magically be able to scale up an intervention package that was tested on a small scale here with lots of resources, but then leaving this process more to chance. So I just wanted to make sure that I emphasize this before I let everybody go. So let's see, are there other questions? Shamarid is asking a question about our experience designing and testing and innovation in pilot projects. So I just laid out so briefly one of the experiences that Alexis and I were involved in. And the interesting thing that happened with Hope LVB, which was able to begin with the end in mind, was that when we got to the scaling up strategy development part, they were much better positioned for scale up than other projects that we've been working with that had not begun with the end in mind. And as I think I said, we developed the beginning with the end in mind guidance because people kept saying to us as we were giving technical support for strategy, scaling up strategy development, they said, if only we had thought about this sooner. And that's why we've developed the guidance beginning with the end in mind. And so I'm pointing you back to that guidance, but also the 9-step approach. And some of the papers that you'll find, Dr. Mareed, on our website talk about how the projects that we worked with applied this guidance and what was learned in that process. So if we point you to the resources page on the ExpandNet website, you'll find lots of different, including the Hope LVB experience, of projects who have learned from this process of really thinking strategically and systematically about scale up. So Lucille has a question about the 4th type of scaling up, which I conveniently didn't mention, which is actually, we call it spontaneous scaling up. And this is where there is no particular strategy, there's no guidance, there's scaling up is just happening magically kind of, but without any particular explicit guidance to the process. And this is an interesting conundrum for the scaling up practitioners of the world, because on the one hand, we want to see that there's spontaneous adoption of interventions, right? On the other hand, those of us in particular in reproductive health and family planning, for one thing, our innovations don't scale that spontaneously. They often need a fair amount of guidance and some handholding. But number 2 is they can a little bit go off the rails. In other words, sometimes the spontaneous scale up work that's happening, by osmosis doesn't go very well. And so we sometimes need to take some corrective action to make sure that that process is unfolding appropriately, that it's not going to create any backlash against the appropriately implemented intervention package. But one other thought is that we can also learn from spontaneous scale up. Sometimes there's something that's happening there that maybe in the Hope LVB project where Alexis and I worked, there was a lot of spontaneous scale up of, for example, the agroforestry interventions where there were people copying what was being done and it was working well. For certain things, it can work very well and you can learn how to capitalize on that learning if you use it. So I hope that answers the question from Lucille. So right now I don't have any more questions from anybody. So maybe I'm gonna pose a question to you. And that is, what have been some of your biggest learnings from either your experience or your observations about what makes scale up or sustainability efforts succeed or fail? We want to learn from failures as well. Many of the colleagues we've been working with over the years have had, they worked very hard for a number of years on scaling up X or Y, and we've heard they've gone back a couple of years later and there's absolutely nothing left of the intervention. And even though many tens of thousands or millions of dollars were spent. And so, I mean, from our perspective, we would probably call that a scaling up failure. And we want to learn from those too. And so maybe I want to invite you to just speak. You don't have to type, just go ahead and unmute and tell us maybe what some of your learnings may have been about either from your experience or your observations about what made a scale up effort succeed or fail. And so let's open the floor and invite anybody to share some of your learnings.
My name is Wendy Schweiger, and I'm on from Greensboro, North Carolina. I work with an organization called the National Board for Certified Counselors. We have an international mental health training that we offer, and we have learned the hard way that if we don't have buy-in from absolutely everyone who's going to be involved in the decision-making, everything from funding to decision-making to things like meeting with ministries that are over that particular kind of program, then we're setting ourselves up to have a lot of trouble in scaling up. And that's been from some failures as well as from some successes over time.
That's a really helpful input, Wendy. Do you want to share any more about some of the successes? What else made it work besides a wonderful participatory process that really helped guide and the scaling up process to unfold? Do you have any other?
I'm a counselor by training and work for a counseling organization. And we've learned that we can't assume that what works for counseling or mental health in the United States would work anywhere else. Mm-hmm. So making sure that we have local experts, people who work regularly, even if they're not, you know, mental health professionals per se. And of course, that's defined differently all over the world. But they know their population. Let's say if we're working in the schools, the teachers know the children and they know what they need. What will help them in terms of mental health or mental wellness. And so having them help us contextualize and adapt the curriculum so it can best serve their population that they're trying to meet.
Great. That's a wonderful example of having people in the user organization to help shape the intervention package. That's a really essential learning that we also can reinforce your learning with some of what we have in our guidance tools. So thank you for those great contributions. Would anybody else like to share some successes or failures from your observations or your own experience that others can learn from? Don't forget to unmute. Of course, Alexis and I can fill the rest of the time. We can tell you lots of stories about some of the experiences that we've had, but we also want to hear from you. Or if you have questions for us, please feel free. You can just say them out loud. Dr. Marie, go ahead.
I just, based on your slides, this is an observation that, you know, until unless you have both the vertical and horizontal scaling up going hand to hand, you know, sustainability might not be achievable. So according to my understanding through the slides and some of my experience, I felt like until you have institutional scale up, that will complement the horizontal and both working together will. So what do you think about this observation of mine? Thank you.
Yes, I concur completely. Alexis, do you want to go ahead? You have some great experience to share on this. Don't forget to unmute.
Thank you. Thank you, Dr. Murid. This is something which we are facing times and again. Most of the time, when we look at what happened in some of the work we have been doing, it seems that we don't necessarily take into consideration some of the aspects which are related to the context. Let's take an example. In the country where I am working here now, where I'm based, and even many countries within the Francophone Africa, the law on family planning, for example, has not been changed. It's still the same law which we had during the colonial time. However, since the 70s or 80s, most of our countries do have family planning programs, even though the law has not been changed. How do we go about that? Most of the time, it means that this horizontal scaling up has gone very fast, but the legal aspect of this concept of family planning has not taken place yet. So in actual fact, that chart which we showed can have some variations. For example, very often the scaling up, horizontally scaling up may go faster than the institutionalization or vice versa, depending on how the innovation seems to be not only adopted, but easy to install. So we need to be really able to scrutinize how the environment is affecting most of the work we are doing, because it can accelerate or hinder the progress for the scaling up, and then the chart will be modified accordingly.
Thank you.
Yeah, thank you for the question. And you know, on institutionalization, there's so many complexities to it, right? There's so many different aspects, and in step 5 of the ExpandNet 9-step guide focuses on institutionalization. But there are a lot of times, I think I said this, that people often think of the horizontal expansion and when they think of scale up, and they don't necessarily think of institutionalization. The same holds true for monitoring and evaluation of scaling up processes. People are often really comfortable with like counting the number of service delivery sites that are implementing the intervention package, and so that numerical counting and indicators associated with that. But when one tries to monitor or evaluate the institutionalization process, you often have to rely on qualitative research methods. You have to do more storytelling. It's a little bit more challenging for researchers. And yet it's no less important to understand how the institutionalization process is unfolding and where there are gaps there, and what gaps need to be plugged. And that's where, again, a framework and the guidance tools can help you. I have posed in the chat window the place in the ExpandNet website where our tools and guidance are, and hope that you'll go and use them to the extent that they're helpful for you. We've gotten, you know, lots of feedback over the years that people have found them independently and really benefited from using them in their own planning exercises. So hopefully you will also benefit. But also on the ExpandNet website, there are many other resources for scaling up practitioners, I like to call us. There's a whole bibliography of scaling up related materials, and with about 400 plus entries, but I'll suggest you not visit that for about 2 more weeks, because we're gonna unveil a searchable database there that might be really helpful for you. And right now it's not very well organized. I'm missing a lot of things on the current draft. But do keep coming back and sign up for the ExpandNet newsletter if you are interested. So there's a question about the best way to reach out if there are further questions. And again, I'll point you to the website. There's a contact us page there. And of course, please reach me this week through the conference platform, because you can invite me for tea, I think. We can have a one-to-one conversation. Alexis, the time difference is currently 8 hours to DRC. So remember that when you invite Alexis for tea this week, but he is also available. And I really want to thank everybody for coming, because this conference is really an exciting opportunity for ExpandNet to share some of our learning on scaling up with the implementation community. We participated in the last meeting in Glasgow, and Alexis and I were on the planning committee for this one, in part because we felt that the implementation science field can really benefit from the scaling up field's learning. Of course, scaling up and implementation are really almost sides of the same coin. They're very related, and scaling up is part of implementation science. It's not everything, but for us, we felt that it was important to really hone in this particular content area to provide a lot of guidance to help people with this complicated buzzing, booming confusion. It's not easy to do, and the more assistance that one has, the better. And so that's where we're coming from, and we have the benefit of being able to share a lot of our learning over the years. Any other? I do have one more question, and we have 6 more minutes. So a question I've always had that sort of stems from my lack of full steeping in the implementation science world is, do you all have experience conducting your implementation research projects thinking ahead to future scale up? And if not, can you tell us a little bit more that that's maybe not been your focus, or whether you would think that it's important or not? I think you probably do, because you're here today with us instead of somewhere else. And if you have done that, what did that look like for you? So that's a question that's about the big fields, the big issues of implementation research and the field of scaling up and how they intersect in your work. And so I would love to hear if anyone wants to respond to that challenging question. And don't forget to unmute. I'll just repeat it again. If you have experience conducting implementation research projects, thinking about their future scale up, and if so, what did that look like for you? Anyone want to take a crack at that? Everybody's muted, so if you're talking, don't forget to unmute. And if you don't want to answer my question, that's fine. I'll tell you about what happened when I posed this question last time at the Glasgow GIC. So when I posed this question during the masterclass on scaling up last time, people said, in fact, that has not been a concern for them. They have not thought about the future scale up when they were doing implementation research. And I was so surprised. And they felt that, I mean, there's no monolithic, but this was really striking to me, because in fact, a lot of the people who came to our masterclass said that it was eye-opening for them. They really had not been thinking about scaling up, had not been realizing that there was a whole body of work that they could benefit from, and they were really excited about that. And so I hope some of you will leave here feeling that way as well. Many of you are working in developed country settings and high income country settings. Alexis and I, all of our experiences come from low and sometimes middle income settings, but it doesn't mean that that experience isn't also relevant for high income settings, nor that the guidance is not relevant. So hopefully you'll get back to us and you'll tell us if you've used these tools and how they've been useful for you. Alexis, let me give you any last words of parting.
Yes, I was burning to have that last word, because
good. Perfect, please.
I wanted to chip in when we were talking about Shay's question with the scaling up in mind. It seems to me that over the years now, we may also start talking about, even if we start with the scaling up in mind, we need to start talking about the element of documentation, which is recommendation number 8 in our beginning with the end in mind. Because most of the time, even for the evaluation aspect, they tend, as you said, to focus on what has been the outcome, and based on that to say whether it has been successful or not. However, since we want to develop an innovation which has a strong potential for scaling up, especially for testability and easy to install. Remember our correct attributes. It seems that we need to start doing careful documentation of the process. How did we do this so that we can be able to communicate to those who want to adopt it, the processes for doing that. I wanted to just come back to that because it has been a very difficult area, the documentation of processes which need to go along with the documentation of the outcome to make sure that it has been successful and it is feasible in other contexts. Thank you.
Yes, thank you, Alexis. And that's a good segue to the implementation mapping tool, which can help with documenting the process of implementation and what is being learned about scaling up during the implementation process. So that's another tool in the ExpandNet tool chest. And I hope as we're wrapping up that everybody's interest has been piqued and that you will stay in touch with ExpandNet, that you will join us in this journey to try to get scaling up onto everybody's radar and really try to create capacity to work systematically on scale up. That is ExpandNet's mission, and it has been since day one, and it will continue forever. So thank you all for coming. It was such a pleasure to organize this session with you and to have your questions. And we wish you a wonderful conference and enjoy the proceedings. And thank you so much for coming and staying with us.